Welcome to the Successful Aging Program. I'm Dr. Dave Donohue. This month we're going to talk about metabolic health and diabetes, type 2 diabetes. So, type 2 diabetes causes a large number of complications throughout the body. This is a condition that we don't want to get. And if we get it, we want to control it as well as we possibly can because really, almost every organ system is affected by diabetes in a negative way. It shortens lives and it causes massive disability. Even prediabetes is a problem, and the National Diabetes Prevention Program in the United States was founded with the intention of averting this tsunami of diabetes that we are seeing. 1 in 3 Americans have prediabetes presently. That number is expected to grow in the coming decades. More than 80% of people with prediabetes don't know they have it. So today we'll talk about how you can know if you have prediabetes. What is prediabetes? There's lots of names you're going to hear about diabetes and prediabetes. So prediabetes is kind of equivalent to the term insulin resistance, which is kind of equivalent to the term metabolic syndrome or syndrome X. Lots of names for kind of the same phenomenon. It is this insulin resistance that is at the root of prediabetes and type 2 diabetes. So prediabetes is associated with a drastically increased risk of all-cause mortality, cardiovascular disease, chronic kidney disease, several cancers, dementia. So it's not, a lot of people think, and the healthcare system doesn't tend to engage with prediabetes. They think prediabetes is a problem when it becomes diabetes, but prediabetes is a problem right now. The good news is it's reversible. And by the way, it also may increase the risk of depression. So dementia, depression, there's a long list of problems when we get prediabetes. I want to tell you about a case, a gentleman who came to see me a few years ago, Venkat. He was 42 years old, and he was living alone, and he was eating poorly, and he had fairly suddenly developed type 2 diabetes with a hemoglobin A1C of 9.8. So this is elevated, a little bit out of control, a lot of bit out of control because the goal is to get it down below 7. His weight had blossomed a little bit, and his cholesterol had come up, and his triglycerides were quite high, almost 400, and his systolic blood pressure was 140. So he had developed hypertension as well. So with all these problems that he had developed, what are we going to do for him? So we're going to start metformin because that's usually the first thing we want to start with type 2 diabetes. But how else can we help Venkat on top of starting metformin? Do we want to start continuous glucose monitoring, enroll him in a group lifestyle change program, refer to a certified diabetes educator, refer to endocrinology, or use motivational interviewing to get him to exercise more? And the answer to this question is enroll him in a group lifestyle change program, because that's what we did for Venkat. And it was an 8-week program that we called Cure Diabetes. We ran to over 20 cohorts before the pandemic of 2020. And in the course of this 8-week program, we educated a lot about the ways of preventing diabetes, of reversing diabetes. And so I'm going to share some of those highlights with you today. A lot of the discussions were about food. We also talk about exercise, sleep, and mindfulness. But food and nutrition play a huge role in whether we develop type 2 diabetes. I want to share with you a little bit of the science that we share in that program, a little bit of the science that's relevant to type 2 diabetes. For example, we have the Adventist 2 trial, where they look at a large population of people, Adventists in California mostly, who were followed for decades, and then they were able to see who develops which diseases. And what they find is that basically the people, the more plant-based was the diet, the lower the rate of diabetes, the lower the rate of hypertension. So this is a population study. It's based largely on food questionnaires. So you always have to look at it with suspicion, but look at the size of that effect. I mean, a 78% reduction. So people who were eating the vegan diet in this community had a 78% lower risk of diabetes compared to omnivores, people who eat regular American food. And the more plant-based that someone became, the lower was their type 2 diabetes in this population. Same for hypertension, too. They were able to slash their risk of hypertension by 75% by eating healthier. And so part of it we think is fiber because we have a lot of evidence that the more fiber you eat, the lower is your risk of type 2 diabetes. But what were they doing in this Adventist 2 trial? The people who were eating vegan were eating a decent amount of fiber, certainly more than the other groups were getting. But interestingly, they were also eating a lot less fat. So they were eating 46 grams of fiber a day relative to the omnivores 30. So more fiber. And how else did they manage to stave off diabetes? They only had about 28 grams of fat relative to 33. Sorry, this is percent of energy intake. So 28% of the energy intake was fat versus 33. So they cut their fat intake by about 5%. They boosted their fiber intake by about 15 grams a day, 16 grams a day. So what was going on there? How can you eat? And the other interesting thing is that we find that they're eating, in terms of calories, they're actually eating about the same. So about 1,900 calories a day relative to even the omnivores in this population were eating a little bit less calories. So how could you eat a little bit more calories or basically the same calories, but have, as we saw, have lower body mass index, because they had a normal body mass index below 25, whereas the omnivores were in the overweight category. So you have lower body weight, less diabetes, less hypertension, but eating the same number of calories. So it could be speculated that it was that because they have better insulin resistance, they're burning those calories more. So basically they're eating the energy and they have energy rather than they feel tired and they're getting fat. So this is one of the reasons why in my hierarchy of lifestyle needs, I like to talk about how I tend to put the plant-based diet before starting to exercise more, because sometimes that's the order in which it happens. You start eating more plant foods, lower fat, more fiber, and you have more energy because you're burning more energy. So then you start feeling like moving and running that 5K. But you can certainly do these in any order, but sometimes that plant-based diet comes before the movement. So this Cure Diabetes program, it was a group program. We came together in a room and we talked diabetes for 6 weeks, 8 weeks, and there was a lot of success. People were losing a lot of weight. Their type 2 diabetes, in many cases, completely reversed. So this is a curable, reversible condition. But people would report things like having lost 44 pounds. They have a lot more energy. Glad that I did not decide to have bariatric surgery. Not that we're opposed to bariatric surgery, but it is absolutely appropriate to change your lifestyle in advance of bariatric surgery. And yes, some people might not need it. So lots of weight loss, lots of reduction of type 2 diabetes. So this approach that we were following, it sounds kind of like a new age medicine or something like that, but it's actually what the recommendations are from some of our most trusted scientific medical bodies, like the American Association of Clinical Endocrinologists. And this is their algorithm to beat type 2 diabetes. They say lifestyle modification underlies all therapy. It's step 1. Avoid weight gains, step 3. And how do we do it? In particular, they call out that you want to restrict calories, but they call out a plant-based diet, and they call out 150 minutes of moderate intensity exercise a week. And these are the pillars of lifestyle medicine: getting solid sleep every night, avoiding excess alcohol, avoiding tobacco. So how did our friend Venkat do over the years? He was able to very quickly, when he made a dietary change, drop his hemoglobin A1C from 9.8 down to 6.2. In fact, he noticed his sugars came down to normal within days of making the dietary changes. What else happened over the course of the first 3 months? He dropped 15 pounds. His total cholesterol came down as much as if he had started a statin medication. His LDL, similarly. Triglycerides dropped more than in half. He cut them more than in half. and his HDL actually went up. So one of the ways that we measure insulin resistance is the triglyceride to HDL ratio. So there's fancier ways of doing it, but from what I read, this is just as good as most other fancy ways. So triglycerides to HDL ratio, if you divide this by this, you're going to get about 13. He had a ratio of 13 to 1 triglycerides to HDL, and that number should be closer to 2 to 1. And really healthy would be 1 to 1. So in other words, your triglycerides would be no higher than your HDL. So he was able to drop it down to about 4 to 5 to 1 from 13 to 1, and that was enough to drop his hemoglobin A1C and make him non-diabetic. But he hadn't solved the problem completely because he didn't get his triglyceride to HDL ratio down to 2 to 1, but he was doing the best he could. He also dropped his blood pressure. Over the course of the ensuing years, by the end of the first year, he was still improving with a hemoglobin A1C that had dropped yet more. This is all on just metformin 500 milligrams once a day so far. And then what else happened? He remained with low cholesterol, low LDL. Triglycerides started creeping up, and his blood pressure remained low. And then at 6 years, he's managed to remain well-controlled diabetes or diabetes-free, depending on how you want to define it, because he's now on metformin 1,000 twice a day and atorvastatin 20 milligrams once a day. But he really was able to change the trajectory of his diabetes, because a lot of people who present to the medical establishment with a hemoglobin A1C of 9.8 are going to find themselves seeing endocrinologists every 3 months for the rest of their lives and taking metformin plus a bunch of other medicines, possibly insulin. And those medicines are great. They prevent complications, but they do not change the trajectory. They do not make you diabetes free. So why do we develop type 2 diabetes? So there's an interesting hypothesis that's come out in recent years called the personal fat threshold hypothesis, which basically means that each person has a level of fatness that will trigger the onset of insulin resistance and eventually type 2 diabetes. And what is that level for an individual is largely determined by genetics. So some people think genetics is what determines whether I get type 2 diabetes. Genetics play a role because they define where is that threshold. But after that threshold has been defined, you have control over whether you're going to develop enough fat to exceed that threshold. So it is lifestyle predominantly is determining whether you get type 2 diabetes. So in this particular study, they looked at 20 people with diabetes for less than 6 years who were not very overweight. Their body mass index was less than 27. So they were close to a normal body weight. And what they found, what the hypothesis says and what their evidence supports is that diabetes is caused by your body storing a little too much fat inside the liver and pancreas, regardless of your weight. So, and why does that happen? It's because as we accumulate fat in the body, some of us are, by our genetic fate, wants to store that fat in the liver and pancreas. And what they found in this study is that upon the loss of about 6.5% of body weight, 70% of the participants, these are people with diabetes for up to 6 years, 70% were free of type 2 diabetes at 1 year. So what did they do? They dropped their body fat from about 32% to about 27%. And the fat in their liver cells, they measured, dropped from 4.1 to 1.4. So that first bit of fat loss is able to really drive the fat out of the liver cells. And it's largely that fat in the liver cells and the fat that's accumulated in the pancreas that's responsible for type 2 diabetes. So that's our goal. We in lifestyle medicine want to treat the root cause of disease. And so how do we treat the root cause of insulin resistance and type 2 diabetes? We get that fat to get out of your liver and out of your pancreas. And the fat in the pancreas cells dropped as well. And what they found in this population is that in those 70%, insulin production returned to normal. So they were actually able to recover the loss of some pancreatic function. And the pancreas, you might recall, its job is to produce the insulin. So they basically made everything start working better. So there's this consensus statement produced by a number of doctors and scientists in the lifestyle medicine community in which that was also endorsed by the American Association of Clinical Endocrinology and supported by the Academy of Nutrition and Dietetics and co-sponsored by the Endocrine Society. So multiple societies came together with a consensus statement, and they basically concluded from looking at a lot of science that type 2 diabetes is preventable and reversible with diet alone, and that shifting to a whole plant food is preferred over just eating less. Because as we want to get that fat out of our cells, we basically have to eat less. But the best way to do that, we think, is to eat better, to eat more whole plant foods. And so one of the exciting insights I wanted to share with you is that for a lot of us, this doesn't have to be as complicated as you think. Like a lot of us are just like 3 weeks away, even less, from reversing our diabetes and even reversing its complications. Here's a study in which they looked at 20 men with diabetes in the 1970s, an old study in which these men were living in a clinical setting, like a metabolic ward, where all the food that they were eating was being provided by the investigators. So we knew exactly what these men were eating. And what they did is they took these men who had had diabetes for as long as several years and put them on a very healthy diet that was, before the intervention, these guys were eating 26 grams of fiber, which is already healthier than what we eat nowadays. I guess people used to eat more fiber, but now we eat fast food more and junk food more. And they were eating a lot of fat, 74 grams a day. And after the intervention, they were able to drive the fiber way up to 65 grams and the fat down to 18. So during the intervention, this is what they ate. They ate a lot more starch. They went from 190 grams of starch to 314 grams of starch. A lot more fiber and a lot less fat. And what do they find is that whereas 20 were on insulin at the outset, only 9 were on insulin at the end of this 16-day trial. Just 16 days. Average insulin requirement dropped from 26 to 11. Total cholesterol dropped from 206 to 147. Basically, in the course of just 16 days, over half these people were able to get off all of their diabetes medicines. This was at a time when insulin was the predominant diabetes medicine. Become effectively diabetes free or very close to it. And to those who still had diabetes, they had much lower requirement of insulin. Here's a case of complications. These are people who were experiencing painful diabetic neuropathy. This is one of the unfortunate complications of diabetes is we get neuropathy where the diabetes is first of all, we can get numbness and tingling. That's a common pattern. Some people get a painful version of that neuropathy. And what they found is that in this population of 21 people with painful diabetic neuropathy, 17 of them were pain-free by day 16. How did they do it? It was another metabolic ward study where they gave people the food and that was all they were going to eat. And what they fed them was whole food, a whole fruit and vegetables, whole grains, legumes, green leafy vegetables, mild herbs and tubers. And they even limited nuts, olives, and avocados, so limiting that fat intake. But many of them were even pain-free in just 4 days. So the point being that you can reverse diabetes and some of its complications in a very short period of time with a diet change alone, eating more plant food, more fiber, and less fat. So, which brings us to a question of carbs versus fat. So it has become very popular to demonize all carbs. Sugar and starch are the cause of diabetes, and to say fat is your friend, and we want to be ketogenic. And it's, in my opinion, it's just not supported by the science. It might be a way to drive down insulin resistance and get some improvement in numbers in the short term, but it is not a healthy long-term strategy. But even in the short term, we can call into question, is this really the best way to reduce fat? So recall that our goal is to lose body fat. To get rid of diabetes, we want to lose body fat, especially as we lose body fat, it tends to come off early in the liver, as we saw. So how are we going to lose body fat? What's the best way to do that? We want to cut calories. We know everybody agrees that. Should we focus on cutting carbohydrate from the diet, or should we focus on cutting fat from the diet. The problem with eating high fat diet is you do burn more fat, but you also have all that fat that you're eating that you got to burn as well. And so the bottom line effect, what they found in this, again, another metabolic ward study in which we controlled exactly what the participants were eating and we could measure very carefully before and after. What they find is if you cut 500 calories of carbohydrate from the diet, you lose about 53 grams per day of body fat. But if you cut 500 calories of fat from the diet, you lose about 89 grams per day of body fat. So this kind of laid to rest a lot of the questions, or it should have laid to rest a lot of the questions around are carbs the enemy or are fat the enemy? If we want to burn fat, a lot of people said if you want to burn fat, you got to eat fat and get ketogenic. Number one, that's a pro-inflammatory state. You don't want to do it long term. And number two, no, it doesn't turn out to be the best way to burn fat. If you want to get fat off your body and end up with less body fat than you started, then you want to cut the dietary fat. It's not the popular message, but that's what the science supports, and it has supported for some decades. So low carb has been measured over long periods of time, and what they find is that when people are eating more animal-based low-carb diets, it increases the mortality risk versus when people were tried on a plant-based low-carb diet, it was able to lower the mortality risk. So it can be done in a healthier way if you're doing a low-carb diet in a plant-based setting. Presumably you're eating a lot more fiber in that setting. This is a meta-analysis of low-carb diets in which they looked at all the studies done to date. And what they find is that that low-carb diets are associated with a 31% increased risk of all-cause mortality. So that's kind of a bad thing. That's not what we're going for in medicine. We're not going for putting you under the ground. As Dr. Greger says, the purpose of weight loss is not to make it so you fit into a skinnier casket. So we want to live longer, first and foremost, and we want to lose the body fat and reverse that type 2 diabetes. So the best way to do it is not to go on a low carb diet. It's probably to eat more whole plant foods like oatmeal. So oatmeal gets vilified, lots of carbs, and a lot of people think, is it bad for type 2 diabetes? They say avoid those carbs, there's a lot of starch in that oatmeal. Well, these researchers tried feeding people nothing but oatmeal for 2 days. So it was an interesting study where they took a group of people with type 2 diabetes that was uncontrolled. And for all of the participants, they had them eat a low-calorie diet of just 1,200 calories for 5 days. But half the participants, they had them eat for 2 days nothing but oatmeal. And what they found is that it was 15 participants in a 5-day hospitalization. So again, they controlled exactly what the people were eating. The group who was given oatmeal for 2 days of a total of about 7.25 cups a day, that's spread across 3 meals. So maybe 2.5 cups a day, 2.5 cups for breakfast, lunch, and dinner. So totaling about 7.25 cups a day. And what did they find? So basically the control group was eating about 50% carbohydrates, 20% protein, 30% fat, about 20 grams of fiber. The oatmeal group, interestingly, ate less fiber, but much less fat, just 7% fat, 12% protein, and more carbohydrates. And so what they found was that just after the study period, fasting glucose and insulin requirement was down significantly in those who were given the fiber. So the total insulin, for those who were given the oatmeal, so the total insulin dropped from 112 units a day down to about 70 units a day. Whereas the group who was not given the oatmeal did not experience a significant change in their insulin requirement. The hemoglobin A1C 4 weeks later was actually down to a statistically significant extent of -1, whereas the control group, this is the only difference between these two groups is for 2 days this group ate nothing but oatmeal, 1,200 calories a day of oatmeal, whereas these guys ate 1,200 calories for those same 2 days of fattier, more regular food, right? But the only difference at a month later was that we see a big drop in hemoglobin A1C. And even these effects were measurable 12 weeks later, although this was not statistically significant. But you do see twice the benefit in hemoglobin A1C at 12 weeks after just a 2-day change in the diet. So this is something that you could try. You could try eating nothing but oatmeal. I want to remind you though that they ate oatmeal and nothing but. There was like maybe some cinnamon and spices in there, but they did not add maple syrup. They did not add fruit or berries or nuts. It was just oatmeal. There was no fat added. So an exciting insight is that just 2 days of eating exclusively oatmeal can reduce insulin resistance dramatically in the short term and measurably in the longer term. So one of the things about eating grains and eating beans is the so-called second meal effect. And this second meal effect refers to the idea that when you eat those beans or intact whole grains, now you're going to have lower blood sugars and lower insulin spike now, but you're even going to have lower blood sugar and insulin spike at the next meal. And so this has been measured with intake of barley. This has been measured with intake of legumes. So we think that it's a good way of keeping weight off is that you're less hungry the next meal if you're eating a lot of grains and beans. So there's also medicines for diabetes, and metformin is definitely something we want to mention because the research is pretty clear that metformin is a beneficial drug. It seems to extend life expectancy. It's one of the few medicines we have that actually extends life expectancy. It's been described as having a geroprotective effect. It seems to reduce risk of cancer, heart disease, and all-cause mortality by 7 to 28% in populations in which it was studied, which is typically people with type 2 diabetes. But I think it's interesting to highlight that we only have a handful of drugs for which we have decent evidence that it might extend life expectancy, certainly in mice, but probably also in humans. And of those few medicines, and this is a changing list all the time, and it's subject to quite a bit of subjective interpretation, but this is my short list of 5 medications that seem to have evidence for which it might extend life expectancy. I highlighted the 3 of them that are diabetes drugs. So it's interesting that diabetes medicines play a big role in in extending life expectancy. So acarbose blocks the breakdown of glucose of carbohydrate into glucose in the stomach and in the small intestine. Canagliflozin is one of the so-called SGLT2 inhibitors, and what they do is they cause you to urinate out glucose, basically. And then metformin, as we discussed. Clearly, glycemic control plays a role in longevity. I want to highlight also exercise. Exercise is critical for maintaining healthy insulin resistant state, healthy metabolic health. The more, it's the same as always with exercise. The more you do, the better. But that said, there are a couple tricks that you can follow. Strengthening is important. Building muscle mass is important. Sarcopenia is the enemy. And as we do strength training, we get rid of some of that body fat and we increase body muscle. But also exercising 30 to 90 minutes after a meal when blood sugar is at its peak does a very good job of dropping your post-meal insulin spikes, of dropping your level of insulin resistance. So love the idea of exercising. In fact, a great weight loss strategy is after you've eaten your meal, instead of deciding, I'm hungry, I want some dessert, get out and do a brisk walk instead. So instead of adding on calories, packing on calories at the end of the day, you're going to be burning off calories at the end of the day. There is a very big benefit from doing that. So Dr. Michael Greger, his new book, How Not to Age, is a trove of insights, 13,000 scientific references on how we can live longer and live better. And so he identifies his 11 pathways of cellular aging. And so it's no surprise that one of them is glycation. So when we talk about glycation, we talk about having too much blood sugar around in your body. And that's harmful because it damages all your organs. But I want to tell you that one of the ways that it damages your organs, the primary way, is it forms these advanced glycation end products. So basically, that excess glucose in the body gums up the works. It binds to things it shouldn't be binding to. And it causes dysfunction. It causes dysfunction of almost every organ. It's involved in causing Alzheimer's disease, Parkinson's, stroke, and it's involved in causing pulmonary fibrosis, lung injury, COPD, certainly heart disease in all its forms, arthritis, liver disease, kidney disease. The formation of these advanced glycation end products is what that elevated blood glucose is causing. But it turns out you can also eat advanced glycation end products, and they can do the same kind of damage as if you had had diabetes. So it's the advanced glycation products that you form when you have elevated blood glucose in the setting of insulin resistance and diabetes, but it's also the advanced glycation end products that you eat. These are also called glycotoxins. They are toxic to the body. You can see the effects of glycotoxins. They cause aging of the cells. They cause younger skin to become more wrinkly. They cause younger kidney cells to become more aged and less functional. They cause younger neurons to become less functional. Throughout the body, they damage the body. You can see AGEs in the ingredients list if you see caramel coloring. Caramel coloring is a highly advanced glycation end product containing processed food that you don't want to eat. So it is a marker for a processed food that is just junk food and you shouldn't eat, including these Boca burgers. So it is disappointing and disheartening to see that even sometimes high fiber bread is going to have caramel coloring added to it. Some forms of balsamic vinegar. So look for the balsamic vinegar that's natural, that does not have caramel color. So caramel coloring causes cellular aging. You can see AGEs in the toast. When you take that bread and cook it under high dry conditions, you form advanced glycation end products. You can see it in the browning of cookies that you baked goods, anything you're browning typically involves advanced glycation end products. The roasting of tofu, you're forming advanced glycation end products, and it's healthier to cook foods at lower temperatures in moister conditions. Certainly lots of advanced glycation end products in meat. You can see it on the surface. There's also heterocyclic amines. There's also other kinds of cancer-causing agents that form when you cook meat at high temperatures. You see those strips of brown, dark brown, that's high in AGEs. The lighter brown is also high in AGEs. So anything that's baked, broiled, the barbecue is just loaded with advanced glycation end products. So what's the most concentrated source of advanced glycation end products? It is barbecued chicken thighs was the number one measured with the skin on. So again, the barbecue is the main source of advanced glycation end products. But there it is. Look at the amount of advanced glycation end products in that food. Grilled hot dogs, very, very high. Basically, when you take meat and you cook it at high temperature under dry conditions, even microwave sausage, though, very high. But broiled tofu is almost as bad as microwave sausage. Feta, American cheese is high in advanced glycation end products. But look at the plant foods, very, very low. So when you look at foods that are raw, like an apple, you look at popcorn or even a roasted yam, even if you roast a vegetable like a yam, it's very low. So plant-based foods are much lower in advanced glycation end products. And plant-based foods, broiled tofu is pretty high versus non-broiled tofu is going to be much lower down. So you want to stay away from, it's about the cooking and it's about the food selection. So what is your assignment this week? This week, I encourage you to, number one, identify if you have insulin resistance. So you can look at some of the lab work that you've had done in the past. An ideal fasting glucose is below 100. Ideally, if you're not on diabetes medicines, ideal fasting glucose can even be below 70. Ideal hemoglobin A1C would be less than 5.7, even less than 5. And the lower, the better. And The ideal triglyceride to HDL ratio would be less than 2. Different publications in different populations cite different thresholds, but the lower the better. But as we get with a triglyceride to HDL ratio over 2.5, we've got insulin resistance. If we see our hemoglobin A1C getting up toward, above 5.7 or getting above 6.5, significant amount of insulin resistance. Diabetes is defined as a fasting blood glucose over 126 or hemoglobin A1C above 6.5. So another assignment, if you like, is you can try out continuous glucose monitoring. This gives you insight. For 2 weeks, you can put this device on your arm and follow your glucose and see what things are spiking your glucose. You can actually get one of these things for free from Freestyle Libre for a limited period of time. I think that's going on now as I record this. And for some people, you're going to find that I don't have insulin resistance and my sugar never really spikes. But other people might find that yes, that eating certain foods, sometimes it could be a little more surprising what foods spike your glucose. But ultimately, so that I want to hasten to mention that this is not the ultimate answer. This tells you what your glucose is doing. This does not tell you to what degree am I accelerating my insulin resistance. So it's ultimately about reducing my level of insulin resistance. So toward that, I highly recommend an insulin resistance reversing diet. So trying to getting away from the processed foods, getting away from the high fat foods, emphasize the beans, emphasize the intact whole grains, get that second meal effect. When you eat low fat, that's the best way to lose body fat. So you're eating low calorie density and you're affecting long-term weight loss. So you want to limit the advanced glycation end products in your diet. And toward that, you can eat raw foods. You can eat raw broccoli and raw carrots. You can eat raw fruits. You can eat raw tempeh. You can eat moist foods, foods with their natural moisture, like boiled potatoes or boiled cooked whole grains or steamed broccoli. You can eat less processed foods. So going for the edamame over the tofu is even a little healthier, for example, but the list goes on. You want to eat cooked food at low temperature. Avoid smoked food. So unfortunately, that lox that people like to have with their bagels is very high in advanced glycation end products. And microwaving or boiling foods ends up being a better way of cooking foods from an AGE perspective than when you roast it. And so that is my presentation. And with that, I wish you all the success in identifying whether you have insulin resistance and preventing insulin resistance and preventing type 2 diabetes and even reversing your diseases. Good luck, everybody.